Hello, I'm Michelle Marisi, for those who don't know, licensed acupuncturist in the greater Providence area, and I've been leading a class series on the water element for the winter season, which is associated with the kidneys and the bladder in Chinese medicine. So we've been talking about the kidneys the past couple weeks, their functions in the body, and the being, I should say, because it's more than just the physical roles in Chinese medicine ascribed to each of the organs or meridians. And then last week we talked about some common causes of kidney pathologies. So today we're going to talk about what those pathologies actually are. And so in Chinese medicine there are two main kinds of pathology: deficiency and excess. So a lack of something or too much of something. And you can check out my past videos on how deficiency patterns present and how excess patterns present if you want to dig into that more foundation. Otherwise, we will get into these kidney pathologies. So with the kidneys, it's really only deficiency pathologies, which relates back to what we were talking about in a previous class, how the Jing, or essence, that we come into this life with, which is passed on from our parents, that is finite, and that is stored in the kidneys, and that is part of the foundation of the kidney qi. And so there's just only so much Jing that we have. We can do things to preserve it, but you can't really add to it. And so for that reason, the kidneys, issues with the kidneys are due to deficiency. So there may be patterns that, deficiency patterns that present with excess symptoms or cause excess patterns, but the root is always a lack, a deficiency. And so we'll also mention a bit about tongue and pulse presentations, which, if you want more background on that, there's some past classes that I led on tongue and pulse diagnosis that you can check out. So with the kidneys, the two of the main patterns are kidney yin and kidney yang deficiency. So you are probably familiar with yin and yang, but just as a refresher, yin and yang are the two kind of most basic energies from a Chinese medicine perspective that are interdependent and that are at the root of everything within us, within the universe. And so we need both in balance to live. And then sometimes, or oftentimes, the one will go out of whack, or one will be more excessive than another. And so with the kidneys, first of all, with yin and yang, yin is more so in relation to yang is quieter, slower. It's like our substance. It is there's a ability for solace, for quiet, for for slowness. There's kind of a richness to yin. There's a proper hydration, and yang is more configurative, so it kind of gives shape to that more, the substance of yin, and yang is more so our energy, our movement, activity, that kind of inner fire, and so with kidney yin deficiency, there can be a lack of hydration, essentially, whether or not that means you're actually taking in enough fluids. It could be you're not properly absorbing those fluids, or those fluids aren't properly being distributed, but there is this kind of drying up, essentially, that often comes with yin deficiency, and a lack of restfulness. So yin is kind of like our ability, our capacity for restfulness. So stress, chronic stress, probably the biggest cause of yin deficiency. And so this can present as a restlessness, in relation to the kidneys. It can also present as night sweats, dry mouth at night, lots of things like at night or later in the day, which are the more yin times of day. If you're having symptoms, that is often related to some kind of yin deficient pattern. A lot of menopausal symptoms can be indicative of yin deficiency, as well as yin deficiency with an excess pattern that we'll get into in a little bit. And the pulse might be tight, which is like a kind of thin, hard feeling, and rapid, which in a Chinese medicine perspective is faster than 4 beats per breath. And there might be like some irritability. The tongue would be red and peeled or partially peeled, which is like there's no coating on the tongue. And a healthy tongue, there's like a thin white coating. So in these yin deficient tongues, it might be kind of raw looking, red, maybe cracked. And then yang deficiency, on the other hand, is maybe lethargy, feeling cold, kind of slow moving, achy, might be heavier set. But these patterns can also go together. You can have a little bit of both. As we age, we inevitably are depleting our kidney energy, and so most older people will present with some kind of yin deficiency or yang deficiency. Another thing is the couple other things with the urination. For yin deficient pattern, it would tend to be darker in color, like indicating a lack of hydration, and also more scant urination, so just less urination, less frequent. With yang deficiency, it might be more excessive, frequent, copious, clear urination. You may also, with kidney deficiency, get tinnitus or tinnitus, that ringing in the ears. With a yin deficient presentation, it would be a higher pitch. With the yang deficient, it would be a lower pitch. And with yang deficiency, you may also feel like achy, particularly low back and knees are signs of something, some kind of kidney pathology, especially if you're older or have been through chronic illness. And the tongue will be pale as opposed to red, maybe kind of swollen, and just kind of flabby and like flaccid. And then the pulse would be deep, so kind of you can't feel it on the surface level. You have to sink your finger a bit deeper to feel that that pulse. With yang deficiency, there may be no thirst, whereas yin deficient folks will tend to be thirsty, and even more particularly thirsty, but only wanting to sip, like small sips, not to guzzle their drink all at once. So yeah, maybe low back and knee pain, or feeling of coldness in the back, or cold limbs, aversion to cold, so just not wanting to be cold. May have impotence or infertility. So reproductive issues can be related to the kidneys, not necessarily. And the pulse for yang deficiency may also be on the slower side, so slower than 4 beats per breath. So another kidney pattern, again, deficiency pattern, is called kidney qi not firm. So this relates to the kidney's role of controlling water, which is, or governing water. And that is, the kidneys are seen as controlling the transformation and transportation of body fluids. So particularly issues with body fluids in the lower jiao, the lower body, could be a result of the kidney qi not firm pattern. So the kidneys are too weak to kind of properly govern the body fluids, and so you might have this kind of leaking out of either urine or like sexual emissions, vaginal discharge, premature ejaculation, maybe frequent urination or incontinence, or dribbling urine, dribbling after urinating, or weak stream. So issues of that nature, perhaps paired with kind of like a fatigue, maybe aches in the low back and knees again, and that like deep pulse indicating this weakness of the kidneys. And then the last kidney pathology that's simply a deficiency pathology is the kidney failing to receive qi. And so this relates to the kidney's function of receiving the qi. They control the reception of qi from the lungs that we breathe in, and they kind of root that qi. And if there's a deficiency there, there may be shortness of breath, asthma, there may be especially shortness of breath on exertion, or even just like light exertion that wouldn't typically cause that breathlessness, maybe some congestion in the chest, as well as like spontaneous sweating or excessive sweating. That also relates to the lungs, which open and close the pores. So if there's this weakness in the kidneys, it may result in this failing to receive the qi from the lungs. And then I lied, there's one more deficiency, pathology, kidney essence or Jing deficiency. So like we were talking about before, the kidneys store the Jing or essence that we inherit from our parents. You can kind of think of it like DNA or genetics, and it's responsible for our growth and our reproduction, development, including sexual maturation, fertility, conception, and even pregnancy. So how well someone's pregnancy goes may relate to the robustness of their Jing. So in kids, poor development or developmental issues, poor bone development, even like mental issues may be, or it would indicate a Jing deficiency, as well as definitely bone and teeth issues relate to the kidneys. Hair falling out could be a sign of kidney deficiency, especially as people get older. Weak knees, like we were talking about before, weak sexual activity, also weak immunity, constant infection. So like beyond that childhood stage of when your immune system is building up to just kind of this ongoing or excessive weak immune system and susceptibility to sickness, like cold and flu. And deafness can also be related to kidney Jing deficiency. So those are the patterns of deficiency related to the kidneys. And then just a couple that are kind of combination excess deficiency pathologies. So kidney yang deficiency with water overflowing. This is essentially edema of the lower body. So maybe around the ankles, this fluid retention. And the tongue in this case would be pale like it is for yang deficiency, and definitely, or more likely, would be swollen, indicating that retention of fluids. And then kidney yin deficiency can be paired with what's called empty heat or empty fire blazing. So that is the pattern that you would see like with someone who's menopausal, going through hot flashes. So it's not what we would call true heat. And some hormones can be related to yin or yang. Similarly, certain minerals can be seen as more yin, and a lack of those minerals or a lack of proper absorption could result in this yin deficiency. So yin deficiency is a broad term, it encompasses a lot of things. So to get more into the nitty-gritty, that may be a underlying cause of the Chinese medicine pathology, yin deficiency. And so for kidney yin deficiency with empty heat or empty fire blazing, the tongue would be again red, peeled, so no coating, kind of raw looking, or partially peeled, and perhaps with a crack in it, or cracks in it, and the pulse tight, so kind of thin and hard and rapid. We'll pause there with because there's lots of different kidney pathologies, but we'll talk about more of them later, and we'll do some practice to support our kidneys. So I'm going to pause, and I'll be back shortly for some Qigong.